My name is Patricia Woods, and I will be talking to you today about cultural and diversity considerations when doing a contact investigation. Our learning objectives today will be define cultural competency, state the 4 elements of cross-cultural communication. What is the importance of cultural competency? Healthcare workers need to be aware of and sensitive to cultural diversity, life situations, and other various factors that shape a person's identity. Homelessness, joblessness, literacy level, or medical problems that affect quality of life are life situations that can affect us. A one-size-fits-all approach will not work, particularly in TB where so much depends on successfully establishing trust and rapport. The first step is an open, non-judgmental attitude. What is culture? Well, culture has been defined in numerous ways, but most simply, it's the learned and shared behavior of a community of interacting human beings. What is cultural competency? Well, cultural competency refers to an ability to interact effectively with people of different cultures. Okay, we have a question. Which of the following characteristics best describes a person who is culturally competent? Someone who has the skills, knowledge, and understanding about another culture that allows them to assess and intervene in a culturally appropriate manner. Someone who has an awareness of their own existence, sensations, thoughts, and environment without letting it have an undue influence on those from other backgrounds. Someone who knows what questions to ask because they accept and respect cultural differences and have knowledge about diverse cultures. Or D, all of the above. If you pick D, all of the above, you are correct. Just smiling or hanging out with people from other cultures does not make you culturally competent. It takes some work and some skill building. Here are some examples of diversity categories or cultural groups. There's geography, there's culture, gender. By gender, it could be it may be inappropriate to work as a provider for a particular gender, a spirituality, or it could be religious. Religious beliefs may limit or prohibit particular types of medical care. Parental status. Some households may have more than one generation that lives in the household, and this may pose a question of who makes the decisions. We have homeless persons, substance users. It could be language, disability, sexual orientation, age, incarcerated persons, or profession. Example, like a healthcare worker can be a cultural group. We're going to go over the 4 elements of cross-cultural communication. The first one is awareness of one's own cultural values. Are you attentive to your own preconceived notions of other cultural groups? The origins of our own cultural values and how they impact our behavior, particularly during patient interactions, is important to know. As a healthcare professional, having an awareness of our own beliefs and biases, as well as our verbal and nonverbal communication styles, will help us avoid social gaffes that may offend our patients and adversely affect the relationship. Good patient-provider relationships are built on trust and respect. Awareness of cultural differences and acceptance of cultural differences. Do you look for opportunities to meet and interact with individuals who are from cultures other than your own? It is helpful to remind ourselves that behaviors we consider customary in Western or American culture may be viewed differently by non-Western cultures. For example, pointing may be considered rude in some cultures, or smiling may mean that they're sad, where we might think it means that we're happy. You have to look for cues as to the social norms of the group, family, or the patients you're working with. If I make an assumption about someone with no effort to confirm its appropriateness, this is a stereotype. If I take some information, the assumption, and use it as a point of inquiry, I am generalizing. Generalizing can be a starting point of gathering information. We also want to be open-minded, show some curiosity, which means a genuine curiosity about people and culture will help fuel an ongoing development of cultural knowledge. And approaching each encounter with this attitude can transform preconceived attitudes. Number 3, develop our cultural knowledge. Are you familiar with the worldviews of cultural groups other than our own? It's important to recognize the cultural beliefs of others that may impact patient health beliefs and health-seeking behaviors. And number 4, ability to adapt to the cultural context of the case. Do you know how to navigate cross-cultural interactions? Adapt interactions and interventions to more closely fit the patient's cultural expectations of care. Okay, time for another question. Which of the following is an element of cross-cultural communication? A, awareness and sensitivity to verbal and nonverbal cues. B, doing a self-assessment of each cultural interaction. C, using stereotyping as a starting point of your interview. Or D, A and B. If you pick D, A and B, you are correct. Stereotyping is not the starting point. Rather, generalizing would be a starting point. So what can culture affect? It can affect description and communication of symptoms. Sometimes there may not be a translation for a symptom or a side effect that someone's trying to express. Perceived causes of illness, understanding of infection, transmission, and contacts. Some cultures might perceive their illness as something that was done as karma, or something that they did that may have caused their illness that has nothing to do with infection and transmission. Health-seeking behavior. Where do they go for their care? Do they go to a physician, or do they go to someone in their community? Understanding of disease process, treatment, expectations, and decision-making. It can also affect interaction with healthcare systems and healthcare professionals. Attitudes towards helpers and authorities, reluctance to reveal contacts, how a person identifies or describes their contacts. A person may be described as their neighbor, but still lives in the same household and not a family member. Ask questions to get to know the individual. How do you prefer to be addressed? Some cultures rather be addressed in a formal manner, like Mr. or Mrs. Others may be rather the informal. Where were you born? How long have you been in the United States? This is important information for us when we're doing a contact investigation or getting to know our patients. If they've only been in the U.S. for a short period of time, they may have other issues that you can assist them with. Or if they've been here for a very long time, they might have a better understanding of our healthcare system. Are you more comfortable reading information in your native language or in English? How are important healthcare decisions made in your family? In some families or cultures, it's a collective cultural system, and some are individual. In a collective system, the family might be made as a group decision, or there might be a head of the household. Are there certain healthcare procedures or tests that your culture prohibits? What do you want to find out? We want to know language and the literacy level We want to make sure that they understand what we're giving them and telling them. Their health knowledge and their health beliefs. Their health-seeking behaviors. Again, where do they go for their health care, or do they have home remedies or something that they do when they're sick? Daily routine activities. We want to know the relevant relationships, and this is very important when we're doing contact investigations, which comes to their living situation. Are all the people that they live with family members? Are they friends? Do they know the people that they live with? That can happen in some cultural situations. Are there visitors, or did they travel, or have there been visitors that traveled during the time of their infectiousness? What do you want to find out? Decision-making preferences. Who makes the decisions, and it's very important to include them. Perception and knowledge of U.S. healthcare system. Perception of Western medicine. Other health belief systems. Relevant incentives. What is going to help them the most in their life situation? It is always good to use open-ended questions to generate helpful conversation. Open-ended questions are very helpful to get important insight during a contact investigation. Use sentences like, how did you feel when you learned you had TB? How do you feel about knowing that you may have infected others with TB? What matters most as you are being treated for TB? Tell me anything that may affect your treatment, home visits, etc. What matters most to them about treating TB is very important. Cultural and diversity concerns in a contact investigation. Culture can affect their knowledge, attitudes and beliefs about TB transmission, beliefs about BCG vaccine. They might not believe their PPD results or their IGRA results. It's important for us to explain what a BCG's purpose is and what those results mean, or an IGRA result that does not interfere with a BCG vaccine. Risk and benefits of LTBI treatment, and identification of contacts. Understanding who a contact is. Who's the nuclear family and extended family? Some cultures come from very large families, and they have their core nuclear family, but we also want to look for any extended family that they may have spent time with. Members of a group living situation. Residents of a nursing home, shelter, or jail. That's important to investigate because it's a congregate setting. Fellow drinkers, substance users. Members of a church, temple, or mosque. How long is their services if they are spiritual or religious? Do they spend a lot of time at church or temple or mosque? Some religions, they might be there quite many hours. Co-workers, supervisors, or boss. Are their co-workers also their friends or also their family members? And do they have any visitors during their infectious period? Cultural background may influence a case's willingness to reveal names. Immigration status. This is important to persons not in the U.S. legally. This is a reason they may not give correct names because they have fear that they may be deported or lose their job. Reasons to hide someone or not name them could be they may get them in trouble if their friend is here illegally. They don't want to hinder their friendship. They might get kicked out of their house. They may not want them to know what their medical condition is because there is a stigma with tuberculosis. This might be some reasons they're reluctant to identify contacts. We want to look at the naming systems as well. Different cultures have different naming systems. It could be first, middle, last, two last names, family name first, ask for all names, nicknames, and aliases. Make sure forms and registries can accommodate, and have the case agree to always use the same name. Working with interpreters. This section will cover how to effectively work with interpreters. Language access barrier. 45 million people in the United States speak a language other than English at home. That's approximately 14% of the U.S. population speak a language other than English at home. So what is our impact of a language barrier? Less likely to receive care. If they are going somewhere that does not understand their language, they might have a bad experience and might not want to return. Less likely to understand their care. And if they don't understand why they have to do something, or why we're doing certain tests, or why they have to take this medication, it might lead to them not being adherent or doing what they should do for their TB disease or LTBI. Increased risk of medical errors. If they don't understand how to take the medication, this is a very serious problem and can have huge medical errors, can cause medical risks, which can cause reduced quality of care and less satisfied with care. Using the interpreter. Make sure you agree on ground rules with both the case and the interpreter before the interview begins. Always speak directly to the case. Ask for clarification as needed, and children should not be used as interpreters. Although a trained interpreter is always preferred, there may be times when a trained interpreter may not be available. Planning is required when asking an untrained interpreter to interpret. You should conduct a pre-session with the untrained interpreter so it's clear what you're expecting them to do when they interpret for you. Explain that using untrained family members as medical interpreters is strongly discouraged. However, do not exclude them if the patient wants them to be part of the clinic visit. These are some points of cultural considerations during a contact investigation.